There's going to be a lot of change in hospitals in the next 5 to 10 years as we transition from hospital companies to healthcare companies.
The best hospital will be something that will have a lot of virtual nature to it.
It is going to be substantially more productive than it is today because it has to be.
It's really going to be about realigning access, realigning the patient experience, and providing care on their terms, not ours.
Microsoft has been an inaugural member of the Hospital Tomorrow Conference because we believe that U.S. News & World Report really had the ability to bring industry thought leaders together.
Ladies and gentlemen, please join me in welcoming Brian Kelly.
Over the next few days, you'll hear from an impressive roster of hospital executives and other leading experts with vast experience on the front lines of healthcare. In short, we've gathered the best people with the best solutions in one place at one time. You'll have the opportunity to network and share best practices with your colleagues from around the country. You'll find many of them grappling with the same problems you are in a time of unprecedented tumult and change.
There's no question that the last 5 years has brought more change to our industry than ever before.
I mean, the truth of it is that the consumer, the patient, is really now in charge of their health. It really has been a combination of digitalization of information and, of course, mobile is making a big difference to consumer access to health information.
That fundamental concept of an individual patient with an individual physician has already changed to a great extent.
We're starting to develop a new generation of healthcare users who want more information, they want more choices, they want to be rewarded for preventative care. I think that's going to be a revolution in healthcare.
What matters now is execution. How do we actually take policy and implement it in a way that brings maximum value to people?
Hospital of the Future isn't just about the facility itself, it's about its know-how being spread internationally so that care that happens in Boston can be the same care that happens around the world.
At Henry Ford, we always talk about taking care of the people that take care of people.
I think healthcare is fundamentally a human endeavor. We want people to feel cared for.
These things will also tap into something emotional, something deeply related to why we all got into healthcare. That intense edge, where we're really focusing on solving inexorable problems about destiny, taking on the human condition and moving it a little bit further towards mastery of what we're given on this earth.
Being at the conference, enables us at athenahealth to learn more from presenters. What are the new problems that they're facing, the new solutions that they're bringing to bear.
We've gotten huge payback in terms of our ability to foster new collaborations and to extend and deepen old ones.
As leaders of your institutions, you have an enormous responsibility. The decisions you make now and going forward will affect millions of individual lives and will shape the future of American healthcare. That's why this forum is so important.
Next year, we'll be back in Washington in what will be a very important year. We hope you can join us to continue the conversation.